Hi, Dr. Marty Janning here again. I'm a board-certified otolaryngologist, head and neck surgeon, and board-certified in sleep medicine. Today I wanted to talk to you a little bit about headaches. Headache is a huge topic, and we're not going to cover most of things related to headache, but I wanted to mention the symptom of headache as it relates to sleep apnea. As many of you already know, probably, that a morning headache can be very symptomatic and related to obstructive sleep apnea. It's a very common finding. Possibly up to 50% of patients with sleep apnea will present in my office with a morning headache. There are lots of other causes of headache: migraines, tension headache, cluster headaches. What I do in my office with a headache patient is I try to rule out the ENT related causes like jaw pain or TMJ disorder, visual losses, sinus symptoms, congestion, allergies, stuff like that. But if I see somebody with a morning headache, I will ask more questions related to sleep that would possibly identify somebody who might need a sleep study. So the other symptoms, in addition to morning headache, would be something like, loud snoring, sleepiness. Size makes a big difference. Not in everybody, but the majority of patients who are obese would be more likely to have sleep apnea than somebody who's thin, although it's not everybody. And I think genetics may play a part of that for some thin patients who also have sleep apnea. Specifically, we look at neck size, and for men it's 17 inches and for women it's 16 inches. And if your neck size is larger than that, that puts you at a higher risk. If you have high blood pressure, witnessed apnea, maybe your bed partner has had to nudge you once in a while, they have a sore elbow. Those would be other symptoms and signs related to possibly sleep apnea. We also know that people with bad lung disease, COPD, with heart failure, pretty much anybody with atrial fibrillation or high blood pressure that is difficult to manage with one or two medications, all these patients probably should think about a sleep study, or at least bring it up to your family practice provider or in our office. Also, patients with diabetes and, as I said before, high blood pressure, a lot of them should be considered for things like a sleep study and also a hearing test with possible hearing loss. So morning headache is a very big warning flag or warning sign related to sleep apnea in a lot of patients. So if you have morning headaches, think about talking to your family provider, your family doctor, or with us about other treatment options.